name is Bree Burke, and I'm the daughter of a nurse and minister from Bristol, Tennessee. So, growing up, my parents took us along as they cared for the elderly, delivered food during disasters, and comforted neighbors in crisis. Even when our own family struggled, we were taught to serve. I remember nights when my mom would cry because there was no food, but then somehow she always made these amazing meals out of nothing but basically flour and water. That taught me early service isn't about what you have, but it's what you're willing to give. So when I discovered that there was a job where I could keep doing what I was raised to do, help people, I became a community health worker using the impact model. I wouldn't trade this work for anything that I would ever do again, honestly. Being a CHW means listening to people's stories and truly understanding them and walk with them as they get exactly what they want. One of those people was Serene. When we met, she was unhoused, working a new job, and her children were in foster care. Her biggest goal was to get her babies back. She was drug free and ready to rebuild her life, so together, me and her made a plan. Within 2 weeks, she had an apartment, started parenting classes, stayed in touch with her probation officer, and she sent me proof of all of this along the way. I shared her story with a local women's group that I'm part of, and within a week, the community completely come together to furnish her apartment with beds, dishes, toys, clothes, even a coffee maker and TV, anything she could possibly need to make her house a home. Today, Serene has been clean for over 4 years. She has full custody of her boys back, a beautiful apartment. She's bought her own car, and when she was stable, she allowed me to help her do things like get a primary care doctor, start counseling, go to family counseling with her kids. This past year is my favorite part of her story. She became a community health worker and is helping people just like her get back on their feet, get their kids back, and live a successful life. That's what being a CHW is all about. We don't come in with our own agenda. We ask, what matters to you? Then we walk alongside people to help that happen. Just like my mom taught me with nothing but that flour and water. It's not about what we have, but the heart that we bring to the table. Thank you.
Thank you, Bree. I'm Christy Granstaff, Executive Director of the Tennessee Charitable Care Network, or TCCN, and we are a statewide nonprofit dedicated to strengthening Tennessee's healthcare safety net. We support community and faith-based clinics and programs across the state that serve low-income, uninsured Tennesseans, people who often face complex health needs alongside barriers like transportation, food insecurity, and limited access to care. A core part of our work has been supporting community health workers, or CHWs. These CHWs are trusted members of their communities who bridge the gap between patients, clinics, and social services. They help patients navigate the health system, manage chronic conditions, and address the social drivers of health that directly impact outcomes. TCCN led several grant programs to elevate, connect, and support CHWs through training, shared learning, and partnerships that strengthen their work on the ground. One of those partnerships is with IMPACT, a nationally recognized leader in evidence-based community health worker models. Together, we have been supporting 4 community-based clinics as they implement and strengthen CHW programs using IMPACT's structured, data-driven approach. Through this partnership, clinics receive technical assistance, tools, and coaching to help CHWs work at the top of their role, improving care coordination, supporting patient goals, and driving better health outcomes. This collaboration reflects TCCN's commitment to building sustainable, high-quality programs that improve health outcomes for Tennesseans who need it the most.
Thanks, Christy. I'm Aditi Vasan, and I'm a Director of Care Transformation with Impact Care. In the Impact model, CHWs meet with clients one-on-one to understand their strengths, needs, and priorities for improving their health, set person-centered goals, and then provide longitudinal support aimed at achieving these goals. For each of the 4 community clinics we worked with, we measured the number of individuals served, social needs identified and addressed, and person-centered goals attained. Across all 4 clinics, CHWs served more than 1,000 individuals between January of 2024 and October of 2025. They met with each client an average of 6 times, identified about 8 social needs per client, and addressed about 5 of these needs. Some of the most common social needs addressed included supporting access to needed healthcare, providing social support, and connecting families to food resources. CHWs worked with clients to set an average of 7 person-centered goals per client, and clients had achieved about 80% of these goals by the time they graduated from the program. By partnering with TCCN, their partner clinics, and amazing CHWs like Bree, we were able to make a real difference in the lives of these clients and their families across the state of Tennessee.